Hi team, I've just started a new group in my August 12-week challenge, and we were talking about exercise this week. Now, at Outlook, we have a saying that you can't out-exercise poor food choices. So in other words, if you eat 3 donuts and then you think you're going to run them off on the treadmill for half an hour, that's simply not going to work. The maths just don't add up. I used to run marathons, and when I did the maths, I realized I was lucky if I was burning 350 calories worth of fat in a whole marathon, which is 42 Ks. So clearly trying to out-exercise poor food choices does not work. But the opposite is always true. Just because you are eating well and you're making good, healthy choices doesn't mean you can skip exercise. The human body is designed to move. Everything from our mental to our physical health needs us to move. You know, we're made to be out there foraging, looking for food continuously all day, not sitting on our butts in an office. So if you want to age well and you want to stay a lean and healthy weight and avoid heart disease and dementia and even some cancers, you need to move your body regularly. Even helps with your brain function, right? It helps you make something called BDNF, which actually means that we can get smarter as we age, right? Not dumber. So we all know about the endorphins and the serotonin hit that we get. So exercise is vitally important. At Outlook, we break exercise down into 5 components. That's kind of our Outlook protocol. And number 1 is what we call incidental exercise. And that is how much are you moving in your day-to-day life. Not just a burst at the weekends, not just for an hour at the gym, but in your life, in your job, in looking after the house or the grandkids or whatever your thing is. I really encourage my clients to use a step tracker. I use an iWatch, but it doesn't really matter. It can be a Garmin or a Fitbit or an old-fashioned step counter, you know, the old-fashioned pedometers that go onto your waistband. Any of those work. I think it's a good indicator of how much you are moving. You don't need to do 10,000 steps a day. We get the same benefits from somewhere around 7.5. But I mean, if you're only going to be doing 2,000 steps a day, then nudging that up to 3,000 steps a day makes a big, big difference. So incidental exercise is king. I love to break it down into exercise snacks. So between each task, like for example, after I've recorded this, I will go and walk around the garden or do some push-ups or some step-ups or maybe hop on my exercycle and do 10 minutes of HIIT or some yoga. And I try and spread those. I sprinkle those exercise snacks throughout my day. And you know what? I feel so much better on the days that I do them. I feel brighter. I have more energy. I feel far less fatigued, especially in the afternoon. So I've heard sitting called the new smoking because we're not designed to sit on our chuff all day. So if you're going to the gym for an hour in the morning, and you might think that's awesome, but actually if you're sitting for the rest of the day, you're missing out on a lot of the health benefits from the time that you're spending in the gym. You need to be moving throughout the day too, not just sitting at your desk, not just sitting in your car. I have a standing desk, which I think is helpful. I have a client who's just bought a treadmill to go underneath her standing desk, which I think is amazing. So when I make a phone call, I try and walk. So it's just finding ways that you can become more active in your day. I think tracking your steps without becoming obsessive about it is terribly useful because you can see if it's lunchtime and you've only done 3,000 steps, then you know you need to go down and get the mail from the mailbox or empty the bin or just be that little bit, mow the lawns, be that little bit more active in your afternoon to bump that movement level up. So we don't need to be obsessive. We don't need it to be another gadget that we're watching every 5 minutes of our day. But I think we need to be aware of how much or how little we are exercising. The other big message I have is, if it's at all possible, get out and walk in the morning. If it's at all possible in your life, get out, even if it's just for 10 minutes, and walk in nature in that early morning light, so that you get that blue light onto your retina. It helps to set your circadian rhythm for the day, which means 12 hours later, not 12 minutes, 12 hours later, you start to produce melatonin, which is going to help you sleep better. It also helps to set your ghrelin levels, which is your hunger hormones, throughout the day, and your stress hormone cortisol. So all in all, by moving throughout the day, you are going to live a longer, leaner, and probably happier life.